Ma'am, please. And also, just as a reminder, sorry, if you would state your name and your hometown before you ask your question.
I'm Cheryl Walser-Kramer, Congressman, and I'm from Dubuque. And first of all, I want to thank you for your service for the 1st Congressional District. Okay, here's my question. Adding millions more Americans to a government health care program simply cannot be easily paid for as stated by politicians and bureaucrats. I believe we do not have enough health care providers to provide these services, and less will probably enter these professions as time has shown. It seems like so many of our young people are not interested in math and science, which is obviously required for these professions. We should provide plans just for those 15 million or so who work but cannot afford the premiums. Explain to me what your specific ideas are for coverage and cost containment.
Sure. Thank you very much, ma'am.
One of the most important problems that economists have identified with healthcare right now is that because of the problems in certain parts of the country with what they call overutilization, providing too much treatment that doesn't make people better, and in some cases makes them sicker, and in some cases kills them. They predict that in the healthcare system right now, and I'm talking about everything, private, Medicare, VA healthcare, everything, there is somewhere between $500 and $700 billion of waste every year. So the most efficient way we can pay for a lot of this stuff is eliminating waste in the system. And I've had hearings with representatives from CMS, which is the federal agency that oversees Medicare, and have told them to their face that they've been doing a lousy job of eliminating waste and abuse in the system. That's their responsibility, and it's our responsibility to hold them accountable. But if you look at the cost of this bill over a 10-year period, which is estimated to be around $1 trillion over 10 years, if you multiply that waste, it would pay for this 5 to 7 times over if we can eliminate it. So reducing inefficiencies and making sure people are not being overtreated, especially in South Florida, the Rio Grande Valley, and other parts of the country, is the best way that we can provide efficiencies. But one of the other things that you talked about that's so important is the workforce development aspect is huge for a state like Iowa. And we have a history and a reputation at the University of Iowa College of Medicine, College of Nursing, College of Pharmacy, Des Moines University with the great osteopathic medicine program, podiatric medicine, physical therapy program. What we're doing is we're providing great opportunities to train and educate the next generation of healthcare providers. But unless we can create an environment where they want to stay and live and work here, we're going to have the types of shortages you're talking about. And we also need to make sure that we're preparing our own students at the high school, middle school, and grade school level with the math and science challenges they need, because you're absolutely right. These are very daunting academic requirements. So it's not like you can just say, let's fix healthcare by fixing medical treatment. We have to look at the big picture, and education is a huge component of that. We need to be strengthening the requirements of our academic programs in schools so we can continue to turn out the healthcare professionals, the engineers, and others that we're going to need as a country. But we also have to look at how our other educational spending affects long-term healthcare costs. Because when we cut programming for physical education, and I'm not talking about the kind I had where you throw a couple of dodgeballs out and throw them at each other. I'm talking about lifestyle physical education, where we teach kids healthy nutrition and exercise habits they can take the rest of their life. And then when we talk about nutrition programs in our school, the alarming growth of juvenile obesity will be one of the biggest healthcare burdens this country takes moving forward. So we know from studies that have already been done that by investing money in addressing those problems head on, we will have enormous impact on the total cost of healthcare. So that's what the bill is trying to do, is come up with innovative treatment approaches and how we collaborate on healthcare decision making to get better outcomes without spending a lot of money.
Great, thank you very much.